Serial killers have often taken something from their victims, most of the time body parts, in order to remind themselves how powerful they are. Some serial killers, like Jerry Bruto and Ted Bundy, have even performed sexual acts with their trophies. It is important to understand how serial killers behave socially so we can provide help early on to those that act out the same way. There have been many psychological experiments throughout history explaining the actions of serial killers. As we progress through time, more and more information regarding their behavior is discovered. The incentive that drives serial killers to kill is due to difficult upbringing, societal factors, and neurodevelopmental disorders. Today I will tell you first how serial killers have a difficult childhood, second how external factors cause serial killers to be made, and third how neurodevelopmental disorders affect serial killers. A serial killer is a person who commits a series of murders and has a difficult upbringing. The way a child is raised can be a major factor that leads to killing sprees. According to Dr. Davies, there is a connection between childhood abuse and serial killers. According to Tom and Michael Philbin, who have published a book about serial killers, mentioned that serial killers have a difficult time growing up. When a child experiences abuse, partly due to the fact that the parents are treating the child with no value, the child starts to fantasize about being all powerful and controlling when a situation comes in their way. As adulthood approaches them, they begin to kill people to feel that power and control. As mentioned by Jane Dalton in her article, the link is established between serial killers and animal cruelty. Throughout their childhood, serial killers experience cruelty that later leads to aggressive and violent crimes. Individuals who have been rejected by their parents go to something that is weaker to take out their frustration on. In this case, it's animals. The individual feels a sense of power when they take it out on something much weaker. Dalton gives an example. A serial killer that had instances where they mistreated an animal when they were younger is Jeffrey Dahmer. Jeffrey Dahmer used to practice his butchery on dogs and cats and impaled their heads on sticks. Aside from a difficult childhood, external forces can lead to a serial killer. Society is an external factor that can impact a serial killer in their early life. Society is the one responsible for serial killers. For instance, explained by Ignacio Blanco, a criminologist, a serial killer named Robert Pickton, a farmer from British Columbia, bragged about murdering 49 women. The Canadian serial killer used to pick up drug addicts, prostitutes on the side of the street, murdered them, and feed their remains to his pigs. Pickton was aided by the fact that society marginalized these women and made them seem undesirable. Social media plays an external force that has encouraged many copycats. Explained by Zainab Tufekci, an associate professor at the University of Carolina for Internet and Society, the media has been covering the news of mass killings and has created a cycle of people copying the same things. With the constant killings in the United States, social media has been releasing what weapons and what methods the serial killers use. Copycats will look at social media and be influenced to go out and kill. To demonstrate, Anthony Sowell is a serial killer who has been called the Cleveland Strangler. He was convicted in 2011 for raping 11 women and storing their bodies around his home. Mentioned by Ali Conti in her article How Murder Coverage Can Inspire Copycat Killers, in 2013, an East Cleveland police were searching a garage to the owner of Michael Madison. The police later found the 18-year-old body that Mason had killed and stored around in his garage. Mason admitted that he idolized Sowell in his killings. Serial killers are not only influenced by external factors, but some serial killers have some type of neurodevelopmental disorders that they developed. According to the book Aggression and Behavior, serial killers may have developed neurodevelopmental disorders, which are disorders that affect the brain and last for a long time. Killers often have homicidal fantasies before they actually kill an individual. According to Amber White, an individual who has homicidal fantasies and childhood trauma have a higher risk of becoming a serial killer. Homicidal fantasies are having thoughts and imaginations of killing an individual. Mentioned by Claire Aleli, a professor in psychology at the University of Salford, sexual fantasies increase the risk of murderous behaviors due to partly the fact that there was sexual violence in their childhood growing up. 1 in 4 serial killers have suffered head injuries that affected their brain in their earlier years. Crime authors Tom and Michael Philbin elaborate. A serial killer by the name of Bobby Joe Long suffered head injury earlier in his years. According to Philbin, Bobby Joe Long rode his motorcycle and suffered an accident that caused severe head trauma. He later went on to kill at least 10 women before he got caught killing them. When he got caught, he stated that he felt that as if the reason why he killed the woman was because of his head injury that he had. Otherwise, early on, he never would have killed those women. Overall, many serial killers have traumatic childhoods that have the need to murder and kill in order to feel powerful. External factors such as society and social media can influence serial killers. Lastly, neurodevelopmental disorders can be the cause of serial killers to kill. Knowing these features will help individuals identify signs that could potentially save lives in the future. Thank you.